Hello friends, welcome back to my YouTube channel. So today we are going to deal with the topic encephalitis. So this topic includes a theory portion which may be helpful for nursing exams like DHA, Pometric, NCLEX, etc. So if you have any queries or anything, please comment down and please do like, subscribe and share. So let's see the top definition of encephalitis. Encephalitis is nothing but it's an inflammation of the brain parenchyma. The parenchymal cells of the brain get inflamed due to etiological factors which lead to encephalitis. Let's see the risk factors of encephalitis. Encephalitis mostly occurs in young as well as in elderly people because they are the vulnerable population. And the second one is immunosuppressed. Immunosuppressed individuals include HIV and organ transplant patients. In HIV and organ transplant patients, we can see that the immunity level may be decreased. In organ transplant, there is a high chance of rejection, so the patient will be on immunosuppressed drugs. And lastly, the exposure to insect vectors. When we go to some areas where a lot of insects, mosquitoes and bats, there is a high chance to get exposed. So these are the risk factors of encephalitis. So what is the definition? It's inflammation of the brain parenchyma. Risk factors include young and elderly population, immunosuppressed people and exposure to insect vectors. So next we can see the etiology of encephalitis. The major cause for encephalitis are virus. Under virus, there are a group of virus which leads to the major causative factor of encephalitis. One is HSV, herpes simplex virus, Epstein-Barr virus, West Nile virus, Japanese encephalitis, and other mosquito-borne virus. Other mosquito-borne virus include dengue, Zika virus, etc. And the second one is parasitic. That may include toxoplasmosis. The third one is fungal. Cerebral aspergillosis can lead to encephalitis. Bacterial, and then is T-cell lymphoma patients. Patients who are suffering from T-cell lymphoma may have a chance of developing encephalitis. And the last one is metabolic encephalopathy. Metabolic encephalopathy is nothing but it affects the biochemical functions of the brain. So, what is the etiology of encephalitis? It includes virus, parasitic, fungal, bacterial, T-cell lymphoma and metabolic encephalopathy. So next we can see the pathophysiology of encephalitis. Virus enters the body through the bite of insect vector mosquitoes. So firstly what happens? The virus need to get entered the body. When we get a bite from the mosquito, then the virus enters the body. And after that what happens? The virus will get multiplied, right? So multiplication of the virus cause viremia. The virus will multiply like anything and it will cause viremia. And what happens next? This virus is transported to the target organ, brain, by the blood. So when the virus multiplies in the body, it will automatically travel to the target organ. What is target organ over here? It's brain. So through the blood, the viruses are carried to the brain. And lastly, what happens? The virus proliferate and damage the neuronal tissue. When the virus reaches the brain, it will do their job. It will proliferate and it produces exudates and which causes the normal brain functions to hamper. So this is the pathophysiology of encephalitis. So next we can see the signs and symptoms of encephalitis. The signs and symptoms of encephalitis include headache, myalgia, malaise, fever, altered mental status, seizures, coma, and meningitis. The first one, the patient will be having severe headache and definitely that needs the pain management. And the next one is myalgia. The patient will be having muscle pains and body pain. And patient will also have malaise and fever. Since the virus have entered the body will try to defense it, which will manifest as high degree fever. And since it affects the brain, it may lead to altered mental status. When it goes beyond some point of control, as a complication, it may lead to seizure or even coma. And if the virus attacks the meninges, there is a high chance to get the meninges also affected. So when it leads to meningitis, the patient will develop the signs and symptoms of meningitis as well, like knuckle rigidity, bruised heat signs, curling sign, etc. So what are the signs and symptoms of encephalitis? Headache, myalgia, malaise, fever, altered mental status, seizures, coma, and meningitis. And next we can look at the diagnosis of encephalitis. The first and foremost is assessing of the clinical diagnosis. We need to check with what are the clinical features of the patient, and then we can decide whether the patient is having encephalitis or not. The second one is lumbar puncture. The third one is brain imaging studies such as CT and MRI. So in CT and MRI, we can find low density lesions within the temporal bones, temporal lobes. So CT, MRI are the two imaging studies which are used for ruling out encephalitis. So what we can see over there is low density lesions within the temporal lobes. And the next one is PCR test. This test, after coming of corona, we are more used to the word PCR test. So PCR test is one among the diagnosis used for ruling out encephalitis. The next one is CSF analysis. The cerebrospinal fluid need to be analyzed to rule out the patient is having encephalitis or not. So what we can find in CSF analysis? Through this specific questions which can come for exams. In CSF analysis, we can see that the glucose amount is normal, the protein level is elevated, and there is moderate lymphocytosis. So what are they? Normal glucose, elevated proteins, and moderate lymphocytosis. The last one is EEG. If the patient is having seizures, epilepsy, etc., then we can have a look at the EEG as well. So what are the diagnosis of encephalitis? The clinical diagnosis, lumbar puncture, CT, MRI, PCR test, CSF analysis, and EEG. Next we can see the treatment which is given for encephalitis. The first line of choice is antiviral drugs. What are drugs which comes under antiviral drugs? Isaclovir, foscarnet, and canticlovir. So the first line of management is antiviral drugs, since it is mostly caused due to the virus. The second one is steroids. When we have an inflammation in our body, we will use steroids. The third one is mannitol. Mannitol is a osmotic diuretics. It is used to reduce cerebral edema. So if the patient develops a complication of cerebral edema out of the cerebral encephalitis, what we can give? The patient can be given with mannitol. The next one is anticonvulsants. We have seen the past like that if the patient is having seizures of epilepsy out of the complication of encephalitis, definitely need to have the treatment over it. So anticonvulsants can help it out. The last one is supportive measures. The patient may be in pain, restless, so we need to give the supportive measures like elevating the head end, hydrating the patient, and giving psychological support to the patient. So these are the treatment which we can give for encephalitis. So it's an antiviral drugs, steroids, mannitol, anticonvulsants, and supportive measures. So next we can look at the nursing management of the encephalitis. The first management include vital signs. There need to be a regular update of the vital signs. There should be a 4-hourly chart of the temperature, respiration, and other vital signs to notice any abnormalities in the patient. As we discussed earlier, the patient will be having a higher spike of fever due to the infectious process. So it's always feasible to have a vital signs chart. And the next, responsible the nurses observe for increased ICP. So when some complication arises, since it is a neuro condition, therapy a chance of increased ICP. So as a nurse, we should be keenly observing for any signs of increased ICP, which includes a sudden sharp headache, then any alteration in the what the mental status of the patient, decreased alertness of the patient, and associated with vomiting. These are all the signs of increased ICP. And the next responsibility of nurse is to give medication. So the medication should be administered to the patient at the correct time, at the correct dose. So there should be not be any side effects of the medicines. So a nurse should always be watchful to the any side effects of the medicines, and always keep the head end of the patient elevated. This comes under the supportive messages given to the patient, because the patient may be having some sort of discomfort. So the nurse, as a nurse, we should always assist the patient to decrease the level of discomfort and to provide a moral support to the patient. So always be a helpful hand to the patient. So understand the difficulties faced by the patient, and we need to provide support according to that. So these are the proper some nursing management of encephalitis, which include vital signs, observe for increased ICP, medication, and elevate the head end. So as I discussed earlier, this includes a theoretical part which is helpful to prepare for nursing exams like for degree, for Pometric, for DHA, and for NCLEX RN. So these are the basic content which is included under encephalitis. So some questions may come under from this part. So I would like to include 2 questions so you can comment down the answers. Okay? The first question is, encephalitis is usually caused by, note the term, usually caused by option A, virus, bacteria, fungi. So which is the answer? You can comment down the answer, okay? And the next question is, what is the vaccine which is commonly used to prevent the encephalitis? This also you can comment down. So friends, I think this video is helpful for you. And if you like the video, please do share, comment, and subscribe. So it will be helpful for me as a motivation to do much more videos ahead. Okay, bye.